Human papillomavirus (HPV) causes and treatment. The human papillomavirus (HPV) causes the sexually transmitted infection HPV. Warts are a common symptom, but it can also increase the risk of some types of cancer. Vaccines can help prevent infection. In the United States, around 79 million people have human papillomavirus, and doctors diagnose around 14 million new cases every year. There are different types of human papillomavirus, and some can increase the risk of cancer. Each year, around 19,400 females and 12,100 males in the United States develop cancers that stem from human papillomavirus. In this video, learn what human papillomavirus is, how it spreads, the symptoms it causes, and their treatments. Symptoms of human papillomavirus may appear years after the initial infection. Some types of the virus cause warts to form, while others can increase the risk of cancer. Specifically, human papillomavirus can cause genital warts. A person may have one small skin bump, a cluster of bumps, or stem-like protrusions. These warts can range in size and appearance, and they may be large or small, flat or cauliflower shaped, white, pink, red, purplish brown, or skin colored. They can form on the vulva, cervix, penis or scrotum, anus, groin area. These warts can cause itching, burning, and other discomfort. Other types of warts. Human papillomavirus can also cause common warts, plantar warts, and flat warts. Common warts are rough, raised bumps that tend to form on the hands, fingers, and elbows. Plantar warts are hard, grainy growths that often form on the feet, usually on the heels or balls of the feet. Flat warts, meanwhile, are flat-topped, slightly raised lesions that are darker than the surrounding skin and often appear on the face or neck. How human papillomavirus can lead to cancer. Most people with human papillomavirus do not develop cancer, but the infection can increase the risk, especially in people with weakened immune systems. A high-risk strain of human papillomavirus can change the way that cells communicate with each other, and this can cause them to grow in an uncontrolled way. In many people, the immune system defeats the unwanted cells. However, if the immune system is unable to do this, the cells can stay in the body and continue to grow. In time, this can lead to cancer. It may take 10 to 20 years for a tumor to develop, according to the National Cancer Institute. In the United States, around 3% of all cancers in females and 2% of all cancers in males stem from human papillomavirus. The infection can increase the risk of developing cancer of the cervix, vulva, vagina, penis, anus, oropharynx, including the base of the tongue and the tonsils. Routine screening can lead to an early diagnosis, and receiving prompt treatment can prevent the cancer from spreading. The best course of treatment will depend on the type of cancer, its stage, and the age and overall health of the person. Causes. Human papillomavirus is a virus that transmits through skin-to-skin contact, often sexual contact. The infection can develop in anyone who is sexually active. There may be no symptoms, or the symptoms may appear and disappear. Human papillomavirus can pass from person to person regardless of whether symptoms are present. The strains of human papillomavirus that cause warts are different from those that increase the risk of cancer. In children, human papillomavirus can transmit to an infant during birth. However, research suggests that this risk is relatively low, as the immune system usually takes care of the infection in this situation. Signs of an human papillomavirus infection in an infant include genital warts or lesions in the mouth. If a young child develops human papillomavirus symptoms, it may indicate child sexual abuse. Risk factors. Factors that increase the risk of human papillomavirus include having several sexual partners, having sex with someone who has had several sexual partners, having sex without using barrier protection such as a condom or dental dam, having areas of broken or damaged skin, having contact with warts or surfaces where human papillomavirus exposure has occurred, not having the human papillomavirus vaccination. The risk of cancer is higher if a person has human papillomavirus and has other sexually transmitted infections such as chlamydia, delivered their first baby at a young age, has given birth to many children, smokes tobacco products, has a weakened immune system. Treatments. There is no way to cure human papillomavirus to remove the virus from the body. However, a person can take various steps to remove the warts that human papillomavirus can cause. It is also worth noting that these warts often go away without treatment. Common warts. Over-the-counter salicylic acid products can treat common warts. Do not use these products on warts in the genital area, however. Also, surgical intervention may be necessary. Genital warts. Do not use over-the-counter products on genital warts. A doctor may recommend cryotherapy. This involves using liquid nitrogen to freeze off warts. Electrocorticoid. This involves using an electrical current to burn away the warts. Laser or light therapy. This involves using a high-powered targeted beam to remove the unwanted tissue. Surgical removal. A surgeon can cut away warts in an outpatient procedure that involves a local anesthetic. The best option will depend upon the type and location of the wart. Treatments can remove warts, but the virus will remain in the body and remain transmissible. Prevention. To reduce the risk of contracting human papillomavirus, a person can get the human papillomavirus vaccine. Use barrier protection every time they have sex. Limit their number of sexual partners. Not have sex while genital warts are present. To help prevent the warts from spreading, avoid touching the wart unnecessarily. Wash the hands after touching a wart. Avoid shaving over a wart. Use footwear in public areas such as pools and locker rooms if warts are present on the feet. Treat and cover a wart until it disappears. Avoid sharing towels and other personal items. Vaccination. The Centers for Disease Control and Prevention recommend vaccination at the age of 11 to 12 years to reduce the risk of cervical and other forms of cancer. This type of vaccine comes in two stages, 6 to 12 months apart. People aged up to 26 years who have not received the vaccine should ask their doctors about it. Speak with a doctor to see whether vaccination is appropriate. Anyone who is pregnant should wait until after delivery to have the vaccination.